Kabanda Zubeda Lucky, a resident of Chitende along Entebbe Road, is the mother of 4 surviving children, 2 of whom are living with inborn errors of immunity. She previously lost her first son due to the same condition at the age of 9. Zubeda shares her painful journey, recalling how her son frequently fell sick before doctors discovered that he had fluid accumulating in his lungs.
I gave birth to a normal child, but when it reached 6, shortly after breastfeeding, he started falling sick, going to hospitals, and then they told us he had an infection, bacterial infection, viral infection. So we moved from hospitals to hospitals, trying to find out what could be the problem. So at this one point, he had a bad infection, and then we went to the hospital, and they were giving him antibiotics, which were not responding.
She says it was through a friend who had a child with a similar condition they sought further medical evaluation. By then, the family had already exhausted their finances, moving from one health facility to another in search of answers.
Struggling to find out what could be the problem. By the time we found out that he had that condition, we were exhausted as parents. We were financially exhausted because these surgeries costed a lot of money. The hospital bills, we were exhausted. So we waited. By then we could not get the drugs because they were not in Uganda. As right now we are speaking, they're not in Uganda. So we were advised to fly to Nairobi.
Zubeda describes the darkest moment of her life, the day her son complained of a severe throbbing headache and asked her for a hug. She was busy at the time and did not realize it would be the last hug she would ever receive from him. Today, Zubeda continues to care for her 2 sons living with the same condition.
I have more 2 boys. One is 10 and another one is 4 years. But ever since I lost that child, I got to know a lot of things. I looked out for help. I went into reading because I knew the problem. I went into reading.
She advises parents with children living with IEI to consider homeschooling where possible, as these children are highly vulnerable to infections.
To take these children at school when they are 6, because I witnessed that. I took my child when he was young, but in a term we could go at school 3 times in a term, because he's associating with a lot of children whose immune system is working properly, but his is not working properly. So he ends up catching the viruses or the bacteria that is going to affect them. So once you take them when they are old, at least their immune system, you can try to fight. You can tell him to put on a mask at that age, maybe he can understand. And then another thing is if you can, to do homeschooling until when this child is in senior 1 or senior 2.
She's also calling upon the government to subsidize the cost of medication and make essential drugs readily available in public health facilities.
I have to import this drug from India every month, which costs me around $1,000 every month for the 2 boys.
At Mulago National Referral Hospital, management of inborn errors of immunity, IEI, and related chronic immune-compromising conditions remains a challenge. Health workers cite low awareness, limited diagnostic capacity, inadequate medicine supplies as key obstacles. Dr. John Sekabira, the acting executive director at Mulago National Referral Hospitals, says the hospital has a dedicated IEI project aimed at increasing awareness among health workers, caregivers, and patients while improving overall patient outcomes.
The inborn errors of immunity, which condition afflicts so many patients, but before probably we didn't know the impact of this condition to our population.
Dr. Lucy Amanio, a pediatric at Mulago National Referral Hospital, explains what IEI means and why early diagnosis is critical.
IEIs are rare genetic diseases, formerly known as primary immunodeficiencies. Primary because they are genetic, so they are not acquired and they affect the immune system, so that's why they are called inborn errors of immunity. And these conditions mainly present in children, and they present with frequent infections. They can have severe allergies, they can have various skin infections, and usually there is a family history. So someone else in the family may have similar symptoms to what this child is presenting with. So we've been managing patients in this clinic since January 2025. It's called the Genetics and Immunology Clinic, and it runs in Ward 15. And so far, for the past 1 year, we've registered about 12 patients who are suspected IEI, and out of those, we've confirmed 1 patient with Job syndrome, which is one of the rarest inborn errors of immunity. So even though these conditions are rare, they occur in about 500 patients per million, which sounds very rare, but once you confirm this disease, then you can be able to support this child to live a full life.
Limiting access for many families. She further explains that management may include a lifelong medication, infection prevention strategies, a specialized laboratory monitoring, and in some cases, advanced therapies.
The conditions are very rare, and they are very, very expensive to diagnose and treat. So currently what we are able to do, we can run CBCs, which is a complete blood count, which gives us a snapshot of what's happening in the patient's immune system. And once we find a suspicious CBC, we send this patient to do what we call immunoglobulins. Immunoglobulins are the antibodies that fight infections in your body. And we've been doing this in collaboration with Lancet Laboratories under a project called DARE. So if it's not under the project, it usually costs about 500,000 to do the full panel of immunoglobulins. And this includes IgG, IgA, IgE, and IgM. And these inborn errors of immunity are very diverse, and they present with various symptoms, and they also affect the immunoglobulins differently. So once we find ambiguous immunoglobulin results, then we proceed to do genetic testing for this patient, because all inborn errors of immunity have a genetic basis. We are currently sending samples for genetic testing out of the country, and we've realized that many of our patients cannot afford to do these tests, which cost about maybe $2,500 to $3,000 for the whole process. But currently, we are able to offer this genetic testing for free.
The hospital administration hopes that with sustained funding, the initiative will be rolled out to regional referral hospitals and lower health centers across the country to ensure early screening and proper management of affected children. Zahra Abigaba, UBC.